Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and Lex and OET training. So today's video we are going to discuss very important topic. Before that, I hope everyone would have done your exams, competitive exams so far happened like NORCET and JIPMER completely well. So this is the time for facing the next stage, that is stage 2 NORCET exam, and other exams are also awaited. So continuously study for your upcoming examination. Don't stop your education, don't stop your studies. Okay, so keep on watching the magic pill session and attend all the classes which whatever happening in Metier International Academy. So today the magic pill session is going to be with a important topic, that is ET tube, intubation and tracheostomy. And if you like this video, please like it, share it, subscribe it, and please, those who are watching the video without subscribing, subscribe the video, then only it will motivate us to post more and more videos, guys. Okay, so let's begin the session without wasting the time. See, all the questions, as you all know, we are taken from the previous year question paper. So very important questions only we are discussing from very important topics. So definitely it will be so much useful for you. Let's begin the first one. Appropriate size of the ET tube used in the adult is. Here in this question, the first always we use to find the key points. Here it is a direct question. Appropriate size of the ET tube, that too for the adult. So they have given 4 options like 2.5 to 4 always in mm. So 8 to 9.5 mm, 5 to 7 mm, 4 to 5.5 mm. And here the right answer is what? Option B, that is 8 to 9.5 mm. So why we selected this option? What is the rationale behind this? Is there any formula to calculate the ET tube? Yes, we are going to discuss one by one in detail. See, the rationale behind this is, first I'm going to explain about according to which age criteria, which ET tube size we have to use. First you understand that. After that we have to discuss about that. We are going to discuss about the formulas. Okay, so the first thing is newborn. For a newborn, most probably the tube size will be 2.5 to 4 mm. Okay, and for infant 0 to 1 years, 4 to 4.5 mm, and for children up to 10 years, 5 to 7 mm, and for children above 10 years, 7 to 8 mm, and for adult 8 to 9.5 mm. So these are all the things you're supposed to memory. Okay, so these are all the memory based thing. Please by heart it. Okay, so now we can go to the formulas. What formulas we can use? See, first we are going to discuss about the ET tube formula for more than 2 years. If the person is or child is more than 2 years, what formula we are going to use? Before going to discuss about the formulas, two things you have to know. See, two types of ET tubes are available. The first one is cuffed one and second one is uncuffed one. Okay, for both the thing, minute variation is there. Okay, you know about the parts of the ET tube. Anyhow, we are going to discuss about the parts. See, if the cuff is present, so that is the cuffed one. If it is not, it is uncuffed one. That is very simple. So the formulas for uncuffed tube is age in years divided by 4 plus 4 mm. Okay, and for formula for cuffed tube is age in years by 4 plus 3.5 mm. So this is the formula. If you are applying the age and you are applying this formula, easily you can find out the size of the ET tube. Okay, and how much length you have to insert in the airway. Okay, so there will be a particular marking in the ET tube, but still there is a calculation also. ET tube depth is equal to ETT size into 3, endotracheal tube size into 3. Okay, so whatever the value you are getting, for example, you are getting 20 means only 20 centimeter you have to insert. Mostly what we will do during suctioning, you are inserting the suction tube means at if the suction tube, if it is reaching the carina, immediately the patient will cough. We will be moving it above, or we will be withdrawing it, right? But for ET tube, it will not go up to that. So even if it is going up to that, immediately the patient will cough. We can find out where we have inserted, but no need to do all these things if you know this formula. So what is the formula? ETT size into 3. If you are applying this formula, then easily we can find out how much depth we have to insert the ET tube. Okay, so the next question is, so here we are going to apply some values in the formula and we are going to find out the appropriate ET tube size. Okay, so let's see. For tracheal intubation of a child of 6 years, uncuffed tracheal tube of a following size would be appropriate. Actually, here they are going to intubate for a child of 6 years with a uncuffed tracheal tube. So we are going to use the formula of uncuffed tracheal tube. Okay, uncuffed ET tube formula we are going to use here. Okay, so let's see what all the values they have given here: 4 mm, 3 mm, 5.5 mm, and 6.5 mm. So here The right answer is 5.5 mm. So how we got this 5.5 mm? You can see in this rationale. See, ET tube formula for more than 2 years we are going to apply here, because here the child age is 6 years. So more than 2 year ET tube formula is for uncuffed tube. The uncuffed tube, the word is mentioned in the question. Okay, so uncuffed tube is equal to age in years divided by 4 plus 4 mm. So this is the formula, right? So what we have to apply here, only we need to add the age. So what is the age of the child? 6 years. So 6 divided by 4 plus 4 mm. If you are calculating that, 5.5 mm is the right answer what we are getting. So we have to select the tube of 5.5 mm. Clear, guys? So this is how you have to select the ET tube. So this is the very important question. So both the question what we discussed till now, they have asked 3 to 4 times in the exams. Okay, so that's why we are adding those questions here. So the next question is, the suction pressure for performing nasopharyngeal suctioning through a wall-based suction unit in the adult patient should be adjusted to. So actually here what is happening, the suction, we are doing some suction. Okay, whether it is a AET tube suction or it is a nasal section or tracheal section, whatever it is, we are doing some suction for the patient, because to remove the secretions from the airway. Okay, so what pressure we have to maintain in case of adult? In this question they are asking for the adult. So what pressure we need to maintain in case of adult, in case of children, everything we are going to discuss detailedly. Okay, so what are the options given here? 4 to 50 mm of mercury, 60 to 80 mm of mercury, 100 to 120, and the last one is 140 to 150 mm of mercury, right? So here the right answer is what, 100 to 120 mm of mercury is the right answer. So why we selected this as a right answer? What is the rationale behind this? See, the rationale is, a suction pressure for an adult is 100 to 120 mm of mercury, guys. Please remember this, okay? And the suction pressure for the child is 95 to 110 mm of mercury. Okay, so based upon these values only, we have gone to which answer? Option C, that is 100 to 120 mm of mercury. The additional point what I want to add is parts of the ET tube. I would like to explain here. You can see parts are very important. Image based question, video based questions are very, very important nowadays. So you should know the parts here. Okay, so here it is a connector, that is 15 mm connector, and this is called as pivot point and self-sealing valve. In this valve only they will be connecting the manometer, okay, and they are assessing the or checking the pressure of the cuff. Pressure of the cuff. This is the cuff. Okay, it is present in the tracheal region. The pressure of the cuff will be monitored by the manometer. I will be showing the manometer, and the manometer will be connected in this area only. Okay, so self-sealing valve is the name of this. And the next one is beveled tip, Murphy's eye. Very important. This question already asked in the exam. And this is the cuff and inner and outer diameter and radio opaque line. So radio opaque line is very much useful to identify after inserting the ET tube. Take the X-ray in order to confirm whether the ET tube is placed in the exact position or not. Okay, in order to confirm the position of the ET tube, we have to take what? X-ray. So radio opaque lines will be there in the ET tube. Clear, guys? So the next one is, and the suction pressure for an infant is 140 to 150 mm of mercury. Okay, all these things are memory based things. Please remember these things. Okay, the next one is, a nurse assists in ET intubation. The doctor advised to maintain the cuff pressure of 20 to 25 mm of mercury. So ET into intubation is done, and the doctor is telling to the nursing officer to maintain the cuff pressure. So just now I have shown you, this is the cuff, right? So the cuff pressure, the doctor is saying to the nursing officer to maintain between 20 to 35 mm of mercury. What is the complication if the low cuff pressure is present? What is that? Low cuff pressure is present means what is the complication? See, high cuff pressure and low cuff pressure, both the questions already asked in the exam. This is very, very important one. So please remember. So before that, you can see very clearly the image I have given here. I will be explaining about the image later. Okay, so 4 options they have given here. Risk of aspiration pneumonia. Underline the key point, low cuff pressure. They doesn't ask about the high cuff pressure. If the low cuff pressure is there, means what will be the complication? This is the question. Okay, so 4 options like risk of aspiration pneumonia, tracheal bleeding, ischemia, pressure necrosis. 4 options they have given here, and here the right answer is option A, risk of aspiration pneumonia. See, definitely the cuff pressure is low, means there is a possibility of aspiration. So that is going to be the right one. See, tracheal bleeding, ischemia, pressure necrosis, all those things will be applicable for high pressure. High pressure. Okay, so here in this question the key point is low pressure, low cuff pressure. So obviously aspiration chances are more. That's why we selected option A. Okay, so the rationale behind this is, see the cuff pressure should not exceed 20 mm of mercury. Okay, so 20 mm of mercury, okay, or 25 centimeter of water. If they are asking in mercury, 20 mm of mercury, and if they are asking in centimeter of water, 25 centimeter of water. Okay, so this is the normal value of the cuff pressure. Okay, so the cuff pressure is used to provide the airtight seal in the trachea. Okay, airtight seal in the trachea. Fine. So suppose. Okay, one more additional point is there. The pressure has to be measured every 8 hourly by aneroid pressure manometer. Yes, this is the aneroid pressure manometer. So you can see where it is connected. The aneroid pressure manometer is connected with the sealed valve. You can see here in this question, it is there. Let me show you. Yes. So here, self-sealed valve is there. No, here only this manometer is connected. Okay, aneroid manometer is connected here only. Okay, fine. So in case of low cuff pressure, there is a chance for what? Aspiration. Okay, so that's why in this question we selected option A. In case of high pressure, there is a chance of tracheomalacia. What is the meaning of tracheomalacia? Here I have given the explanation. Constant pressure by the cuff causes tracheal dilatation and erosion of the cartilage. Tracheal cartilage damage will take place. Understand, guys? So on the whole, 4 key points are there, vital points are there in this question. Okay, image based question, aneroid manometer, pressure manometer also I have shown here. Okay, and where to connect it also I have explained. All these things are very important. And the last one, Guedel airway. By seeing the question, you can say that okay, Guedel airway, it is also called as oropharyngeal airway. So very simple only. No, we are going to talk about additional information, additional golden points. Okay, so as you all know, Guedel airway is here. Options are oropharyngeal airway, nasopharyngeal airway, laryngeal airway, tracheal airway. So it is very simple question. That is option A. Oropharyngeal airway is the right answer. Option A is the right answer. So, okay, fine. What is the additional information which is related to this question? You can see here. See, Guedel airway used to maintain the patent airway. You know that the size 40 mm for infant and 100 mm for adult. The common size which is used for infant is 40 mm. Usually it is coming in mm. And the size which is used for adult is 100 mm. Okay, fine. So apart from this, how to select the exact oropharyngeal airway? Is there any other method to select the oropharyngeal airway or Guedel airway? Yes, it is there. You can see here in this image clearly it is mentioned. From the midpoint of the incisor, as you all know, incisor is the upper incisor, lower incisor, which is present in the front, and from that place to angle of mandible. In this image, it is very clearly given. You can see here. So this is the angle of mandible. Okay, so this curve is there. No, this is called as what? Angle of mandible. So midpoint of incisor to angle of mandible. This is the measuring area. In this area only, we have to keep the Guedel airway and we have to check whether it is an appropriate size or not. Okay, and next one is while inserting, you have to insert in this way only. Okay, the opening should face you. Okay, in this way only, but after placing, it should come in this position. It means while inserting, you have to insert in this way. After that, you have to rotate to 180 degree and it will come to this place. Okay, it prevents the back fall of your tongue, of the patient tongue. Okay, while inserting this way, you have to insert and you have to rotate for 180 degree and it will come and end here. Is that clear? These are all the parts of the Guedel airway, that is flange, dental pad, pharyngeal curve, tube. Okay, so there are different size of oropharyngeal airway. Is there two size already we discussed for infant 40 mm and for adult 100 mm and for pediatric, you know, different sizes are there like 50, 60, adult 70, 80. Okay, so large adult and 110. So instead of going with these numbers, it is better to measure like this and we can come to a conclusion. Okay, so these are all the important point what we covered in the Guedel airway. Is there any doubts, guys? So if you have any doubts anywhere, you can drop a message in the comment section. And thank you very much for watching this video. If you like this video, please like it, share it, and subscribe the channel. Okay, so keep watching Metier International Academy YouTube channel for more magic pill session and other government related nursing officer jobs related updates. Thank you very much, guys.